Dr. Kevin Ende again discussing the hairline lowering surgery. Uh, another common question I get about hairline lowering surgery is, should I do the brow lift at the same time as the hairline lowering surgery? We've already talked about the possibilities of doing it, but why should I do it? Well, of course, it makes sense to do the brow lift at the same time because we're already working in that area, and having more than one surgery in that area makes things a little more difficult if they're done at separate times, as opposed to being done with much more ease if done at the same time. One of the additional questions I get is, how much more time and cost does it involve to perform the brow lift at the same time? Well, typically it takes about 30 extra minutes to perform the brow lift with the hairline lowering surgery. And again, this is an open brow lift, but it could also be done endoscopically at the same time as a hairline lowering procedure. I have done it both ways, but more commonly I do it as an open brow lifting technique for the best results. Again, it takes an additional 30 minutes to perform this type of procedure, so there is a little bit higher cost for the facility as well as for the surgical fee. However, the combined cost of doing a hairline lowering surgery and brow lift surgery at the same time is far less than if you did these two procedures at two different times and paid for two different surgeries and two different facility fees. So um, medically, it makes the most sense to do it at the same time because this would be the safest time to do it, number one. Number two, you would only have to go through one procedure as opposed to two separate surgeries. Of course, there's more risk in doing more than one surgery. And number three, the cost would be lower if both surgeries were combined at the same time as opposed to doing two different surgeries.